شر الوسواس الخناس الذي يوسوس في صدور الناس من الجنة والناس.
Thank you, Abdullah. And now we will welcome Professor Lee for opening speech.
My honorable guests from Hargeisa Group Hospital, Dr. Wali, Dr. Hassan, and Dr. Umar, my dear colleague, ladies and gentlemen, my name is Min Lee. On behalf of Taipei Wanfang Hospital, Taipei University Hospital, I'm delighted to welcome you to the 2023 Taiwan and the Somaliland Medical Conference. In 2021, I led the pioneer team from Taiwan to Somaliland, aiming to establish strategic partnership and foster a relationship with this exceptional country. As a result, Taiwan Medical Mission was founded in 2022 with the support of the Taiwan Representative Office in the Republic of Somaliland. Our mission is to collaborate and work toward a mutually beneficial healthcare system. This conference marks a significant milestone. We are greatly honored to have experts from Hargeisa Group Hospital and Taipei Wanfang Hospital, Taipei Medical University, to share their valuable experience and insights. It is an opportunity to exchange our views, broaden our horizon, and analyze the difference and the similarity profoundly in our healthcare system. Furthermore, I believe that by working together, and we can overcome critical challenges and brainstorm effective measures. Today's discussion will be very inspired all the participants to develop a deeper and a more comprehensive understanding of our cooperative efforts. And finally, I would like to thank you all again to join our meeting and enjoy it. Thank you very much.
Thanks to my Taiwan delegation and Professor Lee and also Dr. Chin and my colleague Hargeisa Group Hospital. And I want to tell you something about the Hargeisa Dialysis Center and the short history of the time we established it on Hargeisa Dialysis Center. As you know, before I am starting on the dialysis center, I want to tell you about our objectives and what is actually we are doing on dialysis. The main principle and objective is that we need to remove the fluid patients who have chronic kidney diseases, and then also the uremic wastes, we can remove it when our kidney they are not functioning probably. So that was the main thing, one of the main objectives of the dialysis or hemodialysis, that we can remove the extra fluid and then also uremic toxin. We can also treat the patient who have extra edema. As you know, most of the patients they have, they are uremic, and most of them they have the extra and excess of the fluid. So that was also cause difficult to breathing. So we're removing also with that. And then also we can treat also the patients who have the hyperkalemia and hypercalemia, hypertension, and also the uremic. These are the most, the patients that we had the dialysis in our unit. So if I tell you the time we opened on the Hargeisa Group Hospital in Dialysis Center, it was April 2012. That time, Hargeisa Group Hospital, or we can say the whole Somaliland, there is no dialysis center at all. So my name is actually, I came from in Finland, and I used to work on the dialysis center in Helsinki University Hospital, and then also I have been working also at the King College in London or UK, and I have been also working on in Saudi Arabia, King Abdulaziz National Guard Dialysis Department. So right now I have been working for more than 10 years. I have been working the dialysis department. So the time I came here in Somaliland, there is no dialysis center at all. So when I came, the international organization IOM, to support, the local staff in Somaliland, the local hospital. And the reason when I came, and I have experience the dialysis. So I found in our store, in Hargeisa Group Hospital, I found 2 dialysis machine. And that two machine, the United Arab Emirates donated of the state of Somaliland. But the machine was standing more than, 4 years in the store. So when I found them, then I was realizing, maybe I checked the machinist, and then I noticed, the machine, they are functioning. So then I will decide that I can establish the unit of the dialysis. I spoke to the Minister of Health, and then also I spoke to the Hargeisa Group Hospital Administration, and then we decided that we will open the dialysis center while the machine they are working. So the first thing what we do, there is no center that time, so we started on the what we calling, the fundraising, and the local business people, in order to start, the dialysis center. So we will collecting our, the business people, local business, more than $80,000 that time, because there is no budget to start the dialysis center. So then we starting, the training, because while I know the availability, the consumable, and also the supply, we starting the training. So I starting, the training for 6 months, the doctors and the 12 nurses, including, the doctor and the nurses also. And that, the training will take also the 6 months before we apply also the supply from the outside. And then also that time also that we are building the small classroom size for the department, because there is no department at that time. So the hospital, they're building the small classroom size for the 2 dialysis bed. And that was, what we starting the dialysis center. Then after 6 months, we received, the consumable from the outside. And then it was that the 25 April, it was the historical day. That was the first time to dialysis in the Somaliland and also in Somalia. It is ever, and that was, the historical day. And after that, we were the first hospital who established the hemodialysis center, both in Somaliland and Somalia. So that was, it was exactly, the historical day. And then our department, we started also, as I say, the small classroom, and the glass 1 room size, and that was the too small that time. And we're getting only the one. We started the 1 patient, and then for a long time we get another patient, and this is the way we will start, 1 by 1. So then before, the Hargeisa Group Hospital and opening, the dialysis center, the patient before that, they was dying without, the no treatment. And the most of the patients who have able to go abroad, they will seek, the treatment from the abroad, from the neighbor countries, from Ethiopia and Dubai and India. These the place usually they will go, because they're not available or no service here is the Somaliland. So that was the reason. So the one is we open, patients they will get the service. And during that time, most of the patients died without the profiling, the dialysis, because there is no dialysis center. So the people, they will die. And those who have the money, they can go abroad. But today, we have another situation when you compare. So after some time, when we started on the dialysis center, we will get on a donation. We noticed, there is a lot of the patients who need the dialysis. And I went to myself to Sweden, and then also went also the UK, and also I seek, the support from the hospitals. So I got on the Birmingham, and then also the Sweden. We got also the dialysis donated machine. So we get on at least 10 machines on the dialysis machine, which is donated from the Sweden and the Birmingham. and also we extension the building, and we also getting on the, now, right now we have the 2 dialysis center in Hargeisa Group Hospital. The first, the old one, and the new one, and most of them now we have on the 20 dialysis machine, and so today we are getting, the most of the patients they get the dialysis without, the difficult to get the abroad. So the most of them they get also as a free of charge. We are not the most of the patients, as you know, the dialysis treatment is very expensive, and the most of the patients they not pay anything. So it is through the government support they will get on the free of charge for all the treatment. And then also our patients also came from Somaliland and also the neighbor countries, for example, the Ethiopia, Djibouti, and also the Somalia, and even also some of the patients they are coming from the abroad to come to stay here holiday, the loved one or their family, and many of them they come from the United States or they come from the Europe to stay here 1 month or few weeks in Somaliland. So that also we providing, during that period we give the holiday sessions while they are coming from the America or Europe. So that is also another, what we are also. The number of our patients right now is 110, and 30 of them they are female, and also the male is 80 and patient. So we treated also the outpatient more than 500 patients. They come the outpatient department to follow them before we start the dialysis. And then the other service we are given to our patient, it is also the treatment, the patient inside the hospital, and the most of them we given the 2 twice a week, and some of them we get the 1 session a week, and some of them we give you also 3 times or 3 sessions a week, and that according to the condition of the patient. And as I told you earlier, this service is free of charge. We also providing our patient also follow-up service, and to many of them also we give the department of the outpatient. And our service also including also the arrangement for those who are going to the abroad, and some of the patients they are seeking the renal transplant. So when the patient is going to for example, the India or Turkey, we will arrange all the documents that might be needed. For example, the blood test and other also the physical test. We will make also the arrangement before they leave here. So that we make also, and also we have contacting the hospitals, those who make also the renal transplant. So we arrange any of our patient who is going to abroad in order to get the renal transplant. And then also what we also given we are providing also our patient the healthcare, the counseling, and then also we are given the chronic disease patient also through the media. We given also the information that they need, and at the same time also we are training students from the Hargeisa University or other university also. We training the nurses, we training also the doctors, and to manage also the CKD patient, and also the another service that we are providing. We are providing the medical students, medical staff also. We are training to replace also all the access of the dialysis patient. For example, the central line and IV fistula, and we also providing on as I told you earlier, we are working on the 6 days morning to 6:30 until 10 p.m. We work every day except Friday. So we are off only the Friday. So and we are providing the session, especially the emergency session, especially during the night, and then also the Fridays in case for needed. We also given the extra emergency the session. Those who need during that time the hospital is closed. So we also given also the rotation all the CKD patient inpatient every day, because we do not have in the Hargeisa Group Hospital a special ward for the renal the patient. So our patient you will you can find, any place in the Hargeisa Group Hospital. Some of them may be the ICU, some of them may be the medical ward, some of them may be the gynecologist department. So we will found, all the hospitals. So we will rotate, every day where our, any patient who have the kidney chronic disease. And as I tell you, that we open, the 6:30 in the morning until 10 p.m. 6 days a week. And most of the patients, they're coming from the home, and they go back, after the treatment, after the session, they go back to home. Some of them, they are coming from the inpatient, from the hospital. But the most of them, 80%, they are coming from the outside, from the hospital, from the home. The causes of the CKD is Somaliland. The two most common causes in CKD in Somaliland are, and one of them is the leading one is the hypertension, and that was the most common. So you see our patient, the most of them, they are hypertension, that they are not controlling and they are not treating them. They not take the medication regularly, and also there's sometimes medication maybe there is not good effect. So all this they can cause also, renal disease. So hypertension is the leading. Second, it is the diabetic mellitus. Also, it is also the second, the leading to the renal failure, and then also the other diseases, also the kidney diseases, which is the genetic diseases, and also the prostate and hypertrophy, PBH. Also, the cause, the renal failure. And then also the glomerulonephritis. These are the most common, the chronic the kidney diseases in the Somaliland. And then we have also the acute renal failure. And most of the acute renal diseases, it's cause hypertension, especially, the women who have, the pregnancy. They got on the preeclampsia, and that was, many of the young women, they got on also the renal, disease during, the pregnancy. And the most of them, they will cure, within few days, 2 or 3 days when they get the dialysis. Most of them, they will cure. And then also, many of them also, they have got on this hypovolemia, and they are not, most of them, they are not drinking the water, or maybe the diarrhea. These are also the cause, also the acute renal, the cases that we have in our center. And then also the postpartum also hemorrhage. Many of the patients also, they can cause also acute renal failure, and also the overdose medication. And many of them, they use also the not overdose, but some of them they use the overdose, and some of them they use also the dose which is not prescribed, the doctor, and that also can cause also the many of the renal failure. So the drugs also is the leading to cause renal failure. And then also the toxin. Many of the people, they also they drink mistakenly chemicals, or they can also inhalate, and that also they can, especially they drink in the chemicals, that also the cause also the renal failure. And then also the animal, also the cause, this is the snake. Many of the patients who get the outside of the country, the snake bite them, and then also they will also develop, the acute renal failure. So most of the cases of the acute renal, they will cure. After 2 or 3 days, when they get their dialysis, they will cure. But the chronic disease, as you know, we are given, the life-saving for the remaining the time. So they not cure until they get, the kidney transplant. But at the same time, we are given, in order to live, we can give on the renal, we can give on this service. Our unit right now, we have on the staff, we have more than the 20 dialysis nurses. We have also the 5 doctors, and we have also the 1 engineering, 2 cleaner, and the 2 security men. These are our staff, our unit. Thank you so much.
By Professor Lee, welcome.
In the next few minutes,
I would like to introduce, give everyone a brief introduction of the organ transplantation in Taiwan, especially focused on my hospital, Wanfang. Okay, it's not so far from Taipei to Taiwan, to Somaliland. We spend almost more than 20 hours by flight. However, it's not an obstacle to let us to come here to share our experience regarding organ transplantation, especially focus on kidney.
This transition is a little bit hard. Transition.
Okay.
Waiting for the transition. Yes.
All right. Let me introduce my hospital first. Wanfang Hospital is one of the medical centers who located in the southern part of Taipei City. And as you know, Taipei City is the north part of Taiwan, is in the capital area. And the history of the Wanfang Hospital is not so long compared to the other hospital in Taipei City. We started from 1996. It is the first operated transfer hospital in Taipei, and especially in Taiwan. The building was built by Taipei City government, and it operated by my university, Taipei Medical University, since 1996. During those 20 years, we have several milestones. We got the first hospital accreditation for medical center in 2004, and we got the first recognized by the JCI for the JCI hospital since 2006. And right now currently we are recognized as the smart hospital in Taiwan. Okay, next slide. Okay, as a university hospital, our mission is to be a well-known international high-quality medical center to provide comprehensive medical care for all our people and, of course, our international friends. Next slide. Okay, the scale of this hospital is not so big compared to the other hospital. For example, as you know, Chang'e Memorial Hospital, they have more than 3,000 beds available. In Taipei Taipei Wanfang Hospital, we have totally 715 beds available in several comprehensive units, including the acute care wards and the intensive care unit. We have the 50 beds available, and also we have the dialytic unit for 60 beds available. And totally we have more than 450 physicians. All the physicians was specialized in some of the field. We have totally more than 30 different specialty in this hospital. And also we, as a training hospital, teaching hospital, we train a lot of residents, around 200 per year. And of course, we have several nurses. And we have 800 nurses and the other medical staff. And totally, we have around 2,500 staff work in this hospital. Next slide. Okay, as a medical university hospital, we have several doctors have the academic position. We have more than 30 professors work in this hospital as me, and we have around 30 associate professors, and totally we have 45%. Okay, next slide. Next slide. Okay, please consider the slide for me. Okay, next. Okay, we have totally 45 staff have the academic position in this hospital. Next slide. We set several strategies to promote and to develop this hospital. We not only provide medical competence, medical service, However, we still show our social responsibility through the artificial intelligence hospital, and we not only work as only the medical service, but we also do several research, innovation, and of course, we ask our staff have a lifelong learning experience and learning chance to work in this hospital. Next slide. Who am I? I'm a transplant surgeon, of course, and I work in this field for more than 25 years already. I started my career since 1996. In the first beginning, I worked in the other hospital that's in the east coast of Taiwan. It's a very, very rural area. In that rural area, we have around 20% area of Taiwan. However, it only occupied by 2% general population. So in that area, I developed a very remarkable transplant program, and I worked there for 30 years already, and I recently moved to Wanfang Hospital. This is my the third years working here. And I my training of the kidney is in Taiwan, National Taiwan University Hospital, and also I go to Japan to learn ABOI incompatible kidney transplantation. And my major field, another major field is the liver transplantation. I was trained in Tom Starzl Transplantation Institute in Pittsburgh in 1997, and also I go to Kyoto to learn the live donor liver transplantation. And until now, I operate for more than 300 cases of kidney transplantation, including disease versus live donor kidney transplantation. And I also do more than 100 cases of liver transplantation, that including around half of the liver is coming from a live donor. Next slide. And not only do the transplantation work, but I also engage in several societies. For example, I'm also the member of the council, the Transplantation Society of Taiwan, and also I am the board of director of Taiwan Organ Registry and the Sharing Center, and I also is the NGO, the president of the NGO Organ Donation Association for 6 years already. Next slide. This is the year that we have the first organ transplantation in Taiwan. We start very early in this year. In 1968, in Taiwan, we did the first kidney transplantation in National Taiwan University Hospital. And then in 84, Chang'e Memorial Hospital did the first Asian liver transplantation from a deceased donor. And right now we have 4-line organ transplantation, including the pancreas, heart, lung, and the small bowel. And the majority of the organ transplantation has already become a general daily practice in Taiwan, especially the kidney, liver, and the heart. Next slide. And all the organ transplantation should based on some regulation from the government. We have the Human Organ Transplantation Act since 1987, and it was amended first in 2011. In that act, the majority of the transplantation organs should come from deceased donor. However, because the organ shortage, the government still allowed some regulation for the live donor. The living donor eligibility in Taiwan is restricted in the restricted in the third degree consanguinity since 1987. However, the number of the living donor in this regulation is very, very small number. So Taiwan government start to expand the sanguinity to the 5th degree after 2002. Next slide. And as you know, I am the board of director of the Taiwan Organ Registration and Sharing Center. This is the government-funded organization who in charge in all the service regarding to the organ transplantation and the registration in Taiwan. It was founded especially in 2002 and established a very extensive organ procurement network in Taiwan. All the donor, not only the donor, but also the recipient should register into this center. There's a big computer, and of course, the major thing, the major work in this center, it should be register all the data from the donor and the recipient, and also do the allocation to share the organ between hospitals. Next slide. And we go through this system to have a good, very allocation system. For example, all the recipient hospital should evaluate all the recipient before transplantation and listing them in this computer. And then if once hospital have a potential donor available, all the donor data should register into the system also. And by the electronic allocation system, the hospital will find where the recipient is. So we will contact with the hospital, recipient hospital, and do all the allocation, and then procurement and the transportation. Finally, all the transplant hospital should register all the data through this system after transplantation, and of course the follow-up data. Next slide. And in this website, you can find the real-time registration data. For example, in 6 July this year, at that day we have totally more than 10,000 cases, 10,000 people who are waiting for organ transplantation. At that time, we had already 33 patients who undergo heart transplantation. However, still have 250 patients who are waiting for heart transplantation. So through this system, this website, you can find all the data regarding to organ transplantation and the donation in Taiwan. Next slide. And this is the number of the organ donation in Taiwan last year. After the establishment of the TRC, we have the real data of Taiwan regarding to organ transplantation and donation. Until now, currently we have more than 300 cases of deceased donors who donate their organs or tissues every year. However, the majority of the donors, they donate their tissue only. Regarding the solid organ, only 120 cases of deceased donor every year can available. Next slide. And compared to the other country, we have not so high donation rate. We have only around 5 to 6 people per million population who donate their solid organ per year. Next slide. However, we do a lot of live donor liver transplantation and the kidney transplantation. In Taiwan right now, we have more than 500 cases of liver transplantation, but 80% of the donor is coming from the live donor. On the contrary, for the kidney transplantation, we have donor coming from deceased donor versus live donor every year, and totally 400 cases of kidney transplantation was done in Taiwan. Next slide. And this regarding to the deceased donor versus living donor, as you see, almost the same number compared to both sides. Both donor source. We have until 1 year ago, last year, we have 173 deceased donor who have the recipient who have this donor liver kidney transplantation, and we have 150 available live donor who donate their organ to do the kidney transplantation. Next slide. And in Taiwan, we separate Taiwan into 4 regions. For example, in my region is the Northern Taiwan OPO. In this area, is totally have 46% of Taiwan area. However, it occupied. In this area, almost 20% Taiwan area. However, it occupied by 46% of general population in this area. So the majority of the people live in this area, and we have totally 6 OPO who in charge in the service of the Northern Taiwan OPO. And in this area, we have 10 heart transplantation center, 6 lung transplant center, and around 13 liver transplant center. And of course, we have 17 kidney transplant center in this area. And in other side, this is my previous work here. This is a very big area, but occupy only very small number of the general population. And I worked here for 30 years and developed the transplant program. And now I moved to Wanfang to develop another transplantation program in Wanfang. Next slide. And we've set several strategies to improve the organ donation. And we find what is the strength, our weakness, our opportunity, and our strength in this area. Next slide. And we try to maintain our facility to serve all our people who come in to my hospital have the liver transplantation or kidney transplantation. We should recruit the efficient and suitable organ donor from our own hospital and serve our people. Next slide. By this way, we should establish a very strong infrastructure to maintain and to operate such kind of program. And finally, next slide, we should serve our people who are working into my hospital. As you know, we are the affiliated hospital of the Taipei Medical University. I have another 2 brother hospital, Shuanghe Hospital and the Taipei Medical University Hospital. We use the same strategy to promote the organ donation and the transplantation in another 2 brother hospital. Next slide. This is our infrastructure. Based on the regulation of the TMU Research Center for Organ Transplantation, we divided 2 parts, the transplantation part and the donation part. In different parts, we have several facilities enrolled in this program. For example, we have the surgical department, medical department, and the administrative department to go through this program to help us to promote organ transplantation. And also the same thing we did in the donation part. Next slide. And in the hospital base, we established the same structure to promote all the same thing. Next slide. So in TMU, based on the regulation of TMU, the research center have the same structure and they cooperate with the hospitals, donation and the transplantation center from Shuanghe Hospital, Wanfang Hospital, and Taipei Medical University Hospital too. And also we construct with the other non-affiliated hospital in the same region. Because we cannot close the region to have the contrast with other hospitals, not within this region. Okay, that is the regulation right now we did in Taiwan. Next slide. This is my transplant team in Wanfang. Although we have a very short history, only 2 years, however, we have already recruited 4 kidney transplant surgeons and 2 liver transplant surgeons and 2 heart transplant surgeons. We did the daily practice in terms of the live donor liver transplant, deceased donor liver transplant, and also the live donor kidney transplantation and deceased donor kidney transplantation. This is all our team. We are working in the case with live donor liver transplantation. We procure part of the liver from the donor and implant into the recipient. Next slide. In the past 6 months, we did several cases of the organ donation, including 3 solid organ donor and from brain death donor, and 2 donate their tissue after their death. Next slide. The most important thing we do, at least we do right now until now, we have 3 heart transplantation and 4 deceased donor liver transplant and 5 deceased kidney transplantation. And of course, we did a live donor liver transplant for 3 cases and 1 live donor kidney transplantation in Wanfang Hospital during the past 6 months. Okay, next slide. So this is the milestone of Wanfang Hospital Transplantation Center. When I arrived there since 2021, I started to do the organ donation from the deceased donor after circulatory days. I did the first live donor kidney transplantation at the same years, and of course the first deceased donor liver transplantation was done at the end of the 21st. And also I did first first live donor liver transplant, ABOI incompatible kidney transplantation in the next year. And finally, we start our heart transplantation program since this year. And until now, within these 2 years, we did 6 cases of deceased donor liver, 5 cases of deceased live donor liver, and 9 cases of deceased kidney, and 8 cases of live kidney donation, of course, including several cases of ABOI compatible ABOI kidney transplantation, and we have 3 heart transplants. Next slide. Thank you very much. This is my introduction for my hospital, and hopefully, maybe in the near future, we have the opportunity to cooperate with each other regarding to this issue of organ donation. Of course, liver transplantation is more difficult to cooperate because the disease entity. All the patients with a severe end-stage liver disease, they are very sick. However, for the renal case, I think it's much easier for us to start. Let's start the first beginning with case of kidney transplantation. Thank you.
Okay, thank you, Professor Lee. Now there will be a panel discussion. So is there anyone have the question for Dr. Ahmed and Dr. Lee? Any questions? Any questions for? Yeah.
Yes, thanks for the presentation. I want to ask you the opposite patient. How process take, for example, the renal transplant? If someone seeks kidney transplant in Taiwan, how the inside process will take?
You mean?
I mean the patient we sent to Taiwan. The process, the internal process in Taiwan. How long will it take?
Actually, in Taiwan, if we do the live donor kidney transplantation, the process will go through 4 parts. So in Taiwan, I regularly visit the patient once per week to finish all the 4 processes, and finally